Lab 5, Heart and Blood. So in the lab, you will see different heart models that look something like this, and you are to label the different structures. So here's a sample of another model that we have in the lab. For the posterior view, I would like for you to take a picture and then label the coronary sinus, the great cardiac vein, the inferior vena cava, the pulmonary veins, and pulmonary arteries. That's a total of 5 structures on the posterior aspect of the heart. Since you haven't had lecture yet on the heart, I'd like to do a brief introduction on the anatomy of the heart. So the heart is made up of 4 chambers. The ones on the superior aspect would be your right atrium and left atrium, and inferior chambers would be your right ventricle and left ventricle. That to our Mariab picture here, Mariab, your textbook. We have here the right chambers, atrium and ventricle on the right side, and then you have your atrium and ventricle on the left side. You can also see here the interventricular septum, the structure that separates the 2 ventricles. And then we have the trabecular carne. Those are the projections of your muscles in the ventricles. Okay. You have papillary muscle. These are your rod shape or sausage shapes projections of the um, myocardium that actually suspends the valves, which I'll show you in a bit. And then we have the pectinate muscles in the atria. You can also see there the fossa ovalis, that is a depression found between the right atrium and the right atrium and the left atrium. That used to be a hole, but now it's just a fossa or a depression. We have the walls of the heart. We have epicardium, the outermost, myocardium, the middle layer, which is made up of muscle, and then we have endocardium, the inner lining of the heart. Okay. Speaking of myocardium, many of you have seen this in the lab during dissection. The left ventricle is more muscular, has a thicker myocardium, which makes sense because it needs more power to pump blood to the rest of the body. So let's continue labeling our heart. Aside from the chambers, we have the great vessels, superior vena cava and inferior vena cava. They are bringing blood to the right atrium. We have the pulmonary trunk that splits off, giving you the right and left pulmonary artery. This vessel um, transports blood from the right ventricle to the lungs. That's why it's called pulmonary. So you have the right and left lung, therefore, right and left pulmonary arteries. Then we have the pulmonary veins. Those bring oxygenated blood to the heart, back to the left atrium. And then you have your largest vessel right there, that's the aorta, which transports blood from the left ventricle out of the heart and to the rest of the body. So after the chambers, after the great vessels, we now go to the valves. Valves are doors or gates that open and close, making sure that the flow of blood is one way and does not back up. Our first valve are the ones found between the atria and the ventricles, the tricuspid valve on the right side, and the bicuspid or mitral valve on the left side. And then we have the chordae tendineae. Those are the cord-like tendons that connect the valve or suspend the valve to the myocardium of the ventricles. At the entrance of your pulmonary artery is the pulmonary valve, and at the entrance of your aorta is the aortic valve. So there you have it. Those are the structures of the heart that you will need to label on the models, on the dissected hearts, and of course for the practical exam. So I have here a diagram showing you um, how blood will flow from the veins to the heart and then to the lungs, and then from the lungs to the heart and to the rest of the body. So I would like for you to trace the pathway of Blair or Bobby coming from the right shoulder until he reaches his final destination, which is the lung, whereas Benita, the red blood drop here, which represents oxygenated blood, will find its way to the heart and then to its final destination, which is the left side of the neck. So trace the flow of blood. So sheep's dissection. Many of you, most of you, if not all of you, came back for that. But I also posted a video on our dissection today. So please review that video and again, try to identify the different parts of the heart. Hmm? So in the video, you will see that we probe through the aorta, the pulmonary artery, the vena cava, and the pulmonary veins. And you would know that you're poking through the right hole because it ends up in a chamber. Wherever chamber that probe ends up in will give you a clue on what vessel you're actually probing your instrument in. Okay, the second part of the lab is the anemia. Anemia has many causes. It's not always iron deficiency. It could be other nutritional deficiencies. It could be blood loss. It could be chronic diseases. It could be autoimmunity, liver disease, and so on. Bottom line is when someone has anemia, which by the way is not a disease by itself, it's actually a sign that something else is in trouble in the body. Okay. So anemia is when the cells and tissues of the body are not getting enough oxygen. That's really is what anemia is. In anemia, there could be low hemoglobin or or low hematocrit. So hemoglobin is um, the molecule that gives the red color of blood, but at the same time, it's the one that carries oxygen. Hematocrit is the volume of packed red cells compared to the total blood volume. So if you don't have enough red cells, then you don't have enough carriers of oxygen. But then again, you can also have enough red cells, but they are low in hemoglobin. They're very pale red blood cells, which means again, not enough oxygen. Or on the right side, healthy, you may have enough red blood cells, but they are unhealthy. They're not the healthy kind. They have a different shape. They're destroyed easily. So those are possible causes of anemia. Okay, destruction may be there's anemia because your blood cells are being destroyed either by toxins, an incompatible blood transfusion, um, also underproduction. Maybe you have a maybe there is bone marrow cancer. After all, bone marrow is the factory of our red blood cells. I have a couple of slides in the lab that look similar to this. The first one here is iron deficiency anemia, and you could see that the red blood cells are pale. We do have healthy red blood cells in this image, the ones that are darker in color, but most of the red blood cells are very pale and small. On the other side, it says there's sickle cell. So you could see some normal red blood cells, but you could also see red blood cells that are sickling. They are sickle shape or boomerang shape. Um, the other cells may be looking normal right there, but they can also tend to sickle when there's not enough oxygen. On this slide, you could see the normal blood smear. We have there the red blood cells, the platelets, and the different types of white blood cells, which we covered in a separate chapter. If you remember, you struggled looking for some white blood cells, and that's okay because there's not many compared to red blood cells. But if you look on the other images in this slide, you could see the leukemia. One microscopic field and you could see a lot of white blood cells. You don't even have to move your slide to find one. In fact, in this small microscopic field, you could see 5 large abnormal lymphocytes. The other one at the bottom, that's of course leukemia, a lot of blast cells, but this is probably in the bone marrow. This is not a blood smear. This is likely a bone marrow smear where you could see the abnormal white blood cells. So yeah, that's the lab that we had this Monday. And of course, for the PowerPoint, I provided additional resources that will help you label your heart and some blank ones so you can practice labeling the heart models and also the dissected heart. Okay, that's it. Good luck.